Sure, absolutely. So I'm so glad she's on panel to talk about some of the reasons regarding prevention. But what we're seeing is an increase in women that are actually under 40. That's the highest incidence or new cases of breast cancer. And young women that look just like you here in this room, and the lady to my right. So I'm operating on patients younger and younger. I operated on a 32-year-old yesterday, and a young lady whose sister died of breast cancer at age 27. And so we have really got to be very proactive in terms of prevention strategies. I often talk about the ABCs of breast cancer prevention. One, A is awareness. Be aware of your body. If you see something, say something. It's not just a lump, because there's so many women that I diagnose with breast cancer on a daily basis where they didn't have a lump at all. The other thing that's important is to look for things like nipple discharge, or if there's something different about your breast. Make sure you get your screening mammograms. And if you get a call back, go back. The B is for behavior. Be mindful that it's lots of things that we can do to try to lower our risks, and one of those things is make sure you're exercising. That's super important, just having physical activity. Be mindful of your culinary choices in terms of what you're eating and what you're exposing your bodies to in terms of the environment. And then lastly, C is consumer choices. When we are consuming things, whether it's beauty products, whether it's food, make sure you're reading the labels, because there are a lot of carcinogens that are out there. And so again, I'm hoping that was helpful in terms of understanding prevention and what I've been seeing as a surgeon.
I think very helpful. Because she has to go, does anyone have any questions for Dr. Spencer? Now is the time. Like, you can ask anything that you think of, or maybe that may have some ideas, and she can